So when you publish a bunch of studies that say, hey, look, our surgery is so effective for 90% of the patients, it got them this tiny little change that actually didn't make them pain-free, it makes normal people with hip pain who are desperate for relief think that the surgery is actually going to relieve their hip pain, when in fact, it doesn't. I recently posted a video about hip impingement surgery and how successful it really is in returning people to a normal, healthy state of hip function. And if you haven't watched that video, I will link it in the description box. The TLDR, or the general summary, is that hip impingement surgery is only successful in returning people to normal hip function in maybe 20 to 30% of the patients who get the surgery. So in that video, I talked about a study done in Denmark that showed that people who had hip impingement surgery just weren't that satisfied with the actual surgery, and they actually used some really interesting words. They said that patients who have FAI often go into the surgery being overly optimistic, meaning their expectations are too high. And so the question I asked in that video was, why are people overly optimistic? Because they don't really address that in this study. And you know, a study is probably not going to be done to address that question. So in this video, I want to talk a little bit in detail about that topic. Why are patients with hip pain going into hip impingement surgery overly optimistic? And then what are the alternatives to going into a surgery that fails to deliver on a very consistent basis? So if you're ready, let's get ready to think right, move right, and feel right. I would argue that the reason people with hip pain are overly optimistic going into hip impingement surgery is because doctors and surgeons tell them that they should be really optimistic because they show them all kinds of evidence that the surgeries are effective, when in fact what they're showing them is just a bunch of marketing hype. So in this Danish paper, which I will link to in the description box, they actually have some passages that I think are really important to think about and that really help you understand what's actually going on. So quoting from the study, previous hip arthroscopy studies have mainly used patient-reported outcome measures to deal with the concept of change scores over a specific time period. While such information is important for establishing the effect of a treatment, a change score may be difficult to interpret for the patient who is about to decide whether to undergo hip arthroscopy. To untangle that for you, pretty much all the studies done on hip arthroscopy to fix hip impingement use things like the IHOT-33 or the Harris Hip Score, which are these orthopedic questionnaires that somebody asks a patient, and the patient says yes, no, or they give a number rating, and then they add up all these scores and they say, well, before the surgery, you were a 50, and then after the surgery, you're now a 65. And that means your surgery was successful. Now, the reason this gets really hairy is because they use these numbers to determine whether a treatment, like surgery, is effective, and they do that by saying, if you get a certain number of points more than when you started, it's a clinically significant change. Now, the thing is, what qualifies as clinically significant can be total BS, because the person thinking about what's going to be the cutoff value is generally a surgeon, because these studies are all put together by surgeons who perform these surgeries. So when they come up with cutoffs, they say, well, what's a good number? Well, I say 15. 15 sounds like a good number. It's a big portion of 100, so that's good enough. And if this guy goes from 50 to 65, well, obviously this surgery worked. The problem is when you look at how these things are scored, you can see that a difference of 15 points or even 20 or 25 points often still means you're in pain. You can see that when you look at the metrics. I've even done videos on this where I show you exactly how this scam works. You can see how little improvement a patient can get and still be called a successful surgery. So when you publish a bunch of studies that say, hey, look, our surgery is so effective for 90% of the patients, it got them this tiny little change that actually didn't make them pain-free, it makes normal people with hip pain who are desperate for relief think that the surgery is actually going to relieve their hip pain, when in fact, It doesn't. So this paper goes on, such information can be obtained using the minimal important change score, which I just talked about, with data suggesting that most patients, greater than 66% actually, exceed this and get better from before to 1 year after surgery, meaning their score goes up by a bit. And while this is useful for the patient to know before treatment, this is important, getting better is not equivalent to feeling good, which is normally measured with the PASS score, which I talked about in the previous video. And basically PASS just means you ask the patient, hey, does this feel like you got what you wanted? Do you feel like your hips are good and function normally and you can live with this the rest of your life? And what they found in the study was that less than half of patients who went through hip arthroscopy actually were satisfied with the results. So, while feeling good after hip arthroscopy is often considered a successful treatment outcome, achieving PASS may not reflect a normal state of function. In other words, patients who undergo the surgery are really excited that the surgery is going to fix their problems. It doesn't actually fix all their problems, doesn't get them back to normal function, but they sometimes will still say, well, I'm satisfied with the surgery because it's at least a little bit better than before. But what they noticed in this study was that really only 20 to 30% of patients got back to actual normal function, which is important to note because, 20 to 30%, that's 1 out of every 5, 1 out of every 4, 1 out of every 3, something around that level. That means there are some people who post-surgery are pretty excited, right? They got better, they got back to pretty much normal, and you'll see them being the loudest proponents of this surgery because for them, it seems like that was the thing that fixed them. Meanwhile, the majority of patients are saying, I'm not better, and the surgery didn't work. But you don't see those stories so much because the surgeons aren't going to talk about it, hospitals aren't going to talk about it, no websites that are there for medical information really will tell you that. PR groups that are going to amplify this message of, hey, more than half of people are not satisfied and way more than half don't actually get back to normal function. Who's going to fund that type of PR campaign? Nobody, but surgeons, hospitals, medical groups that make lots of money off of doing these hip surgeries have every financial incentive to push the stories and amplify the stories that make the surgery more and more popular and make people really connect to this very small minority of patients who actually get their hips feeling better. Hey, I just want to take a quick second to thank these people here on screen for supporting this channel. If you'd like to support this channel too, go to uprighthealth.com/donate and you'll find all the simple, easy options while you're there. Sign up for the free Body Rebuilding Basics course. It'll help you rebuild your mind and your body at home so that you can make progress in the long run. And of course, if you haven't subscribed to this channel yet, please subscribe and let's get back to the rest of the video. So when you are thinking about hip impingement surgery, you have to realize that the actual satisfaction numbers are not that good. This paper that was done in Denmark is not the only one that shows such a low satisfaction rate. There is one done about 10 years ago that I will also link to that actually came up with the same numbers. When they asked patients whether or not their expectations were met, less than half felt like their expectations were met. So knowing those statistics, it might be a good idea to consider some other path. I'm not a doctor, I'm not giving you medical advice, but I am telling you that the medical advice out there seems pretty bad if you actually look at the evidence. So in my very non-medical opinion, it makes a lot more sense to think about the muscles that control your hips, because most people in the Western world, while we're glued to our phones, sitting in our seats all day long from childhood to adulthood, we lose control of our hip muscles. We do the same sports repetitively, we do the same positions over and over again, and we never actually maintain a good solid range of motion. We forget how to coordinate basic motions like being able to touch our toes or being able to just crouch down to the floor to tie our shoes. We do all kinds of things to make our hips weak, feeble, and stiff, and then when they get weak, feeble, and stiff, we're surprised and ask doctors to go in and cut things so that things are no longer weak, feeble, and stiff. So what is the alternative? The alternative is to ATM, always think muscles. If you've watched any of my videos before, you've probably heard me say something like that because your muscles control the bones. Bones don't move themselves. You cannot have a skeleton crawl out of the ground on its own volition unless it's Halloween night. You cannot get your arm to move up this way if you have no shoulder muscles. Likewise, you cannot move your leg into positions like this or this unless all of the muscles know how to coordinate together to maintain that position. Some people can't even do this because they get massive spasms in the muscles around the hip. You might feel pinching or jamming because the muscles are either too weak or unable to elongate properly. All of these things can go wrong and they will give you pain, they'll give you discomfort, and the medical system currently tells you you should catastrophize and think that these painful signals mean something is terribly wrong, that you have bone shapes that are horribly bad and that they will just tear up and chew up your hip, when in fact there is no evidence for this. Again, links in the description box for citations. You can read all about this stuff. And I would also encourage you to look at the story of shoulder impingement surgery, which actually follows the exact same trajectory as hip impingement surgery. Shoulder impingement surgery was proposed as this great way to fix shoulder pain. They said, hey, everybody out there has different kinds of bone shapes. And if you have the wrong type of bone shape here, it's going to predispose you to rotator cuff tears and into shoulder pain and labral tears and blah, blah, blah. What they found after multiple decades was that this whole thing was total bunk. The theory doesn't hold any water. And in fact, all those allegedly bad bone shapes, they have no correlation to shoulder pain. They have no correlation to shoulder arthritis. They have no correlation to anything because the majority of people have those bone shapes. Of course, they still perform shoulder impingement surgery despite a total lack of evidence, so that should again make you think a little bit critically about what you're being offered when somebody tells you that the only way to fix your hip pain is hip impingement surgery. So if you want to relieve hip pain and you want to improve your hip function, it seems clear from this Danish study that surgery is not the way to do it. It has a very low success rate. What you could do before to be a little more conservative and to maybe give yourself the best shot of having hips that feel good and move well is to actually try to practice moving your hips well into positions that they're not currently good at. Try learning how to stretch properly, learn how to strengthen muscles properly, and start using your muscles in different ways. That means doing more than just standard boot camp style workouts where you're going through a shallow range of motion and, well, I'm just going through the motions and I must be getting stronger. It means more than doing crappy physical therapy exercises where you're just kind of like dropping a knee out and coming back and dropping a knee out and coming back. It means actually learning how to use the muscles under load. It means using the muscles in lengthened positions, in shortened positions, in all kinds of awkward positions, and learning how to keep your core engaged, learning how to use your back muscles, your shoulders, all of that, because all of this stuff is connected, and if you don't get that, you will just end up feeling like everything is stuck and gummed up. Ugh. Try retraining your hips for at least 6 months and see what happens. If you start noticing things improving, that should be some evidence for you that you can actually make even more improvements. The whole story about the FAI bone shapes is that you're basically doomed, and there is actually no good evidence for that theory. The only thing that theory does is scare you into getting a surgery that has very poor satisfaction rates. So think about whether or not you want to buy into that story. And as you're training your hips, remember that slow is safe and fast is foolish. You don't want to rush into doing a bunch of heavy loaded squats and deadlifts. You want to learn how to coordinate motions cleanly, smoothly. You want to feel the right muscles working as you're doing these things. I have some free workouts that I've got on YouTube that you can start using to improve your hip range of motion, your hip strength. I will link to them in the description box and at the end of this video. I also encourage you to check out the Healthy Hips program on my website at uprighthealth.com/DIY. That is a premium paid program that I put literally years of work into developing, and I've tried to keep it nice and affordable so it never feels like some weird onerous snake oil salesman scam. You don't need to go grab it right this instant. Use some free resources, use my free videos, and show yourself and show your body that positive change is possible despite these silly bone shapes and that you can get your life back. And then if you feel like you need more help, you want a more comprehensive program, a more comprehensive approach with a full schedule and all that, then you can check out the Healthy Hips program. Again, it's at uprighthealth.com/DIY. Find the stuff that's going to work for you. Go find a coach who helps you free up your hips. Do whatever it takes to address the muscles. Remember to ATM. Check out these free videos right here. Subscribe to this channel. And as always, I hope you remember that pain sucks. Life shouldn't.